Welcome to today's webinar, Connecting with Financial Help, Navigating the TotalAssist Portal. I'm Maureen Island, Senior Director of Communications and Marketing at Patient Advocate Foundation. And before we get started, I want to share just a few quick reminders. So today's webinar is for patients and caregivers. If you're a provider or pharmacy, please visit Patient Advocate Foundation's YouTube channel to access the webinar recording from earlier this week, and we'll also be putting that into the chat. Also, I know some folks are putting this in the chat already, but if you are hearing an echo, please ensure you only have one Zoom webinar open and that you aren't connected to both computer and telephone audio. We'll also put some additional resources in the chat to help troubleshoot that issue. Today's webinar is being recorded, and a recording will be shared along with other resources, including today's slides, with everyone who has registered for today's webinar. We ask that you use the Q&A feature to submit your questions during the webinar, not the chat. We will try to answer as many questions as we can during our time together today, but just as a reminder, we are unable to answer any questions about individual grant information or medical situations. Finally, closed captioning is available via Zoom for those who may need it. And if you need technical support during today's webinar, please use the Zoom support link, or you can message the host. Next slide. During today's webinar, you'll be hearing from three of my Patient Advocate Foundation colleagues: Jennifer Brewster, Vice President of Financial Support Programs, Sarah Krusky, Senior Director of Financial Support Programs, and Brittany Stuber, Senior Manager of Provider Program Outreach. Next slide. All right, as you'll see, we have a lot to cover today as we work to ensure you feel confident using the new TotalAssist portal beginning next week. First, we'll give you all a sneak preview of the new TotalAssist.org website that will be launching next week as well, and walk you through how to sign up for our TotalAssist fund notification system so you can be notified when a TotalAssist fund opens. Then we'll dive into the new TotalAssist portal and some of the key actions you can take within the portal itself. And we'll round out our time together sharing some helpful guides and resources, reviewing the TotalAssist launch timeline, and answering a few questions we received as part of today's registration process. As a reminder, these slides, along with the webinar recording and other resources, will be shared with all registrants in the coming days. I'd now like to introduce Jennifer Brewster, Vice President of Financial Support Programs, who will get us started.
Thank you so much, Maureen. As Maureen stated, my name is Jennifer Brewster, the Vice President of Financial Support Programs here at Patient Advocate Foundation. So excited for our Patient Advocate Foundation TotalAssist program launch on July 1. And as we get started, we're going to take a sneak peek at our TotalAssist.org overview. All right, so what you're seeing on this screen, TotalAssist.org, is our homepage. So there's an array of different options that you can use on the homepage. Starting out at the top right-hand corner is our portal login. So this is how you're going to, one of the ways that you can actually access the portal. So you can, if you're a patient or caregiver, you would access the Total portals here. To highlight some additional features on our homepage. There's also a wonderful new quick eligibility checker where you can answer a few brief questions to determine if you actually might be eligible for one of our over 140 disease funds that we will have. So the eligibility checker only takes about 3 to 5 minutes, and you just answer, quick few brief questions and let you know if you're potentially eligible. Also, a couple things to highlight on the homepage. Another way to access the portal is by Apply Now. So in addition to that portal login at the top, you can also select Apply Now, and that will also guide you to apply or log into your accounts on the portal. Next slide. All right, so just highlighting some additional features on our homepage and our main menu. It is, you can click the menu up top to expand, and there's an array of different options to choose from finding your fund, getting information about how to start your application and applying, how the Total Assist program helps you, array of information regarding grants, claims, and portal help. So if you need information regarding like an existing grant, you have questions about submitting a claim or an existing claim, and additional portal help. And some other features on our main menu on the homepage, you can search by disease or medication name to actually find your fund. And we'll go into more details in that in the next slide. But also find information about how to apply to the program and apply online. And then, of course, we highlight our phone number. So if you have any questions at any time navigating our website or navigating on the portal or just general questions, our phone number is highlighted there, and then our operating hours. Next slide. All right, so from our homepage, we're going to go dive into find your fund information. So this is a wonderful resource to find information about the disease that you may be, inquiring about or seeing if you're eligible for. So there's 3 easy steps in the find your fund process. So step number 1, using the search bar, you would either enter in the disease name, medication, or the ICD-10 code to search. You don't have to use all 3. Just pick one that you have available to you, and then you can search. And then step 2, check to see if you're eligible. So whether that's you yourself or if you are a caregiver, seeing if you're eligible for the fund. And then step 3, if your fund is open, we of course encourage you to apply because, as you know, funding does come on a first come, first served basis and can go rather quickly. So, and if your fund is closed that you're searching for, we really encourage you to sign up for our new fund notification system. And we'll go into that on the next one of the next slides as well. But the fund notification system, you can sign up for text, email, or a phone call if your fund is closed. Next slide. All right, so highlighting some additional informations on the homepage regarding grants, claims, and portal help. So our help center is also located on this homepage where you can find tons of information about, your grant. So maybe you want to know how much your award is left. That would be, a great place to use our quick check tool to get that information without actually having to log into your portal account. Another way that you can use our quick check tool is to, check on the status of the claim. So maybe you don't want to log all the way into your portal and you just want to know if your claim's paid. This is a great tool to actually just do a quick check to see if your claim's been paid. And as you can see, also highlighting some additional information on the homepage. We have our help center, our help center topics go from how to apply to the program, what's needed. So say you're approved and is there any additional information that you may need to submit? How to use your grant. So what your grant covers, what you're eligible for, and then information regarding your portal account. Next slide. All right, now we're going to move into signing up for Total Assistant Fund notifications. So as I highlighted a few slides back, we have a new fund notification system that you can utilize to notify if a fund's open. So next slide, and we can go into the details about that. So the Total Assist Fund notifications is available on the website, and you get notified when your fund opens. And as stated before, launching July 1, we're going to have over 140 disease-specific funds, which is really outstanding for our patient population. Just as a reminder, it is a first come, first served basis, for all that funding. So let's go through the steps of how to sign up to get notified for a fund. So first thing you're going to do is you're going to enter in your name. So enter in your full name, first name and last name, and then the email that you would like to register for the fund notifications. Your next step after you enter in your full name and your email is to select your fund selection. So you can select to get notified of all your funds, or if you just want one fund or two funds or three funds, you can make those selections here. So just keep in mind that you can select as many as you want or just one fund. And then after you select your fund selection, you're going to select how you would like to be notified. So, what is your preferred method of communication that you would like to get notified? I know text is a great option. A lot of people want that text message to say, okay, let me go ahead and log into my portal and apply. Or, oh, I got a text message. Let me call into the program so I can, then get a representative to help me apply. So, text, email, and automated phone call will all be an option for you to sign up on how you would like to see fund notifications. And then, after you agree to the terms of use and subscribe, you'll start receiving those notifications. And at any time, you can see at the bottom of the page where you manage your preferences at any time by clicking here. So, say you've signed up for text message and you would rather have an email, you can make those changes at any time. So we're really excited about this fund notification piece for the Total Assist program, and we really encourage everyone to sign up for fund notifications and utilize this exciting tool. Next slide. All right, so we're going to actually, now that we've kind of navigated around the website, we are actually going to move into getting started with the Total Assist patient portal. All right, so let's highlight what's in a portal account and what's available to you as a user. You can log into the Total Assist portal 24/7. You can apply for a new grant. So say your grant's expired and you would like to apply for a new Total Assist grant, that's available to you. And again, if you are, a returning patient, as I stated before, if your grant's expired, you can renew as long as, of course, funding's available. If you're already approved and you need your virtual pharmacy card information, that information is going to be available for you in your portal account. You can also submit claims in your portal account, and you can upload documents. So say you were selected for income audit and you have to, upload documents, you can do that all on your online portal. At any time in your online portal, you can check the status of your award. You can manage your grant balances. You can check the date, just keeping in mind, okay, when do I need to reapply? And check the claim status. So maybe you've submitted a few claims and you want to see if they've been paid or if they're still pending. All those tools are available for you in the portal account. You can also access important documents and updates in the portal account, like your virtual pharmacy card, or if you need a copy of your award packet. All of that information is accessible to you in your portal account. All right, so here is the main login screen for the portals at portal.totalassist.org. We always encourage you, of course, to, if you are a new user or returning user, to really bookmark that portal .totalassist.org for easy use, so that way you can log in and log out. All right, so here is the main features. If you see your username and password, so you can log in if you are an existing user. And then also, if you are a new user, you would want to create your account, that pretty purple button right there. And we're also going to highlight on this page some quick action tools. So as stated before, these are some quick action tools that you can use that actually don't require you to log into your portal. So you can quickly check award and claims informations. You can also, on this page, sign up for Total Assist fund opening notifications here, and also search our help center. So say you've logged into the portal and you have a couple questions and you don't want to go all the way back to the website, you can actually access our help center right here on the main portal page. Next slide. All right, so let's highlight logging in for existing PAF, CPR, or PAN portal users. So starting on 7/1, if you are already a Patient Advocate Foundation copay relief program, you are just going to sign in with your registered username and your password. Nothing is changing for you. So you would actually use your same username, your same password that you currently have now if you are a PAF copay relief patient. No changes. Also, for PAN portal users, you are going to use your existing portal username that you would have had for your PAN account, but you do have to change your password. So the process for that would be for our PAN portal users would be to select forgot password, enter in your PAN portal. You'll select forgot password first, then you're going to follow the prompts to reset your password, but you would still use your actual login email address. So again, just to kind of recap that, if you are a CPR portal user, you would log in using your same information. If you're a PAN portal user, you would use your existing email, but you will have to reset your password. So just wanted to make sure that that was clear. Next slide. All right, let's go through creating a brand new TotalAssist portal account. So these are for users that do not have an account at all. So if you do not have a PAF account and you do not have a PAN account. So just highlighting starting July 1, if you do not have one of those accounts, PAF CPR, you can sign up for a brand new TotalAssist portal account in a few easy steps. So just highlighting again, this is for those patients or caregivers that do not have a CPR or PAN portal account. Your very first step would to be visit that portal.totalassist.org. And just a reminder again to really bookmark that login page so you can really return and for easy access. Step 2, find and click create your account. So there'll be a button that actually says create your account. That was that pretty purple one. Step 3, select the type of user you are. So in this case, you would be a patient registration. Step 4, you're going to follow the prompts and complete the required fields on each screen, then click register. And the information that you're going to complete is all your patient demographic information. So first name, last name, address, all that information will be required for registering. Step 5, you'll receive an actual registration confirmation email link to the email that you use to register. The link is valid for 2 hours. Now, if you're not getting that registration link within 2 hours, make sure that you are checking your junk and spam folder. It might be there. So make sure if you don't receive it, you should receive it rather quickly. And if you don't receive it, make sure you're checking your junk and spam folder. And then again, that link is valid for 2 hours. And step 6, at sign in, you're going to be prompted to complete the multi-factor authentication. This is when you're going to get a special code is sent to your email, and it's an added security step to make sure all of our information input in our system is staying secure. So make sure you check your email and enter your unique code to access your account. Next slide. All right, so when creating a new TotalAssist portal account, again, this is highlighting the button that we kind of went over on our step slide. This is the button that you would select to actually create your account. And a reminder, this is if you don't already have an account. So if you do have a PAF CPR account or PAN portal account, you will not create one. This is if you do not have one. Next slide. Okay, and this is highlighting just some of the steps again. So this is the patient registration button that you would actually select to start the registration process. Next slide. All right, and this is the screen. So just reminding you, this portal is for patients only. So this is where you're identifying these are the these are the members that can apply on the patient portal. So a spouse, a family member, a friend, a guardian, of course yourself. and then you would select the click next button. And as stated before in some of our steps in the patient registration process, here's the criteria that it would request. So your patient first name, last name, date of birth, your email, and also a social security number or alien number. You do have to input a social security number or alien number in order to move forward with the registration process. It is a required field. And then you would create your password and then select the next button. Next slide. And then on the following screen for the registration, this is where you would also enter in some additional contact information. So the phone number that you would like to be contacted with and the type, so whether that's your home, your work, and then the phone number, and then also your address. So, and then we do complete a address validation process to verify that your address is valid. Next slide. And then continuing on creating a portal account, this is where we are actually validating your address. Our system will try to match your address with the known addresses that we have in the postal system just to make sure that they are true and accurate. And if your address can't be verified, it doesn't stop you from going forward. You would just actually select the keep unverified address to continue on with that process. Next step. All right, and as we move into creating a new TotalAssist portal account, there is an option for any authorized persons to speak on your behalf. So if you're a patient and you're applying for yourself, maybe you would like your spouse or your significant other or your partner, a brother or sister, this is where you would enter in that information. Now, we only show one option on the actual screen, but just know that you can actually add as many authorized users. You can add 2 or 3 authorized users into your portal account. And we would just need their first name, their last name, and their relationship to you. And then the, relationship to, yourself if you're answering that. And then also communication preferences. So are we allowed to share any correspondence or communication also with that authorized user? If you do select yes, they will also get information about your award, and that could also include like your award packet. All right, next slide. All right, so creating a new TotalAssist account continued. This is where we actually are capturing some additional demographic information to include gender, employment status, veteran status, marital status, household size, and then race. And then, of course, national origin is also included in this as well. Next slide. All right, so moving on to continuing to create a portal account, we're going to actually review communication preferences. So this is how you would like us to communicate with you. So whether it's going to be by mail, email, and also your preferred language. So currently right now we do have 2 preferred languages, and that is English and Spanish. So those are both options. And then the preferred method of communication is going to be mail or email. And this is for all communications. So if you select email, all of your program communications will be sent via email by what you listed. If you select mail, all your program communications will be sent out by mail. And then also our opt-in or opt-out of communications from PAF is also included on this screen. And this allows us to, contact you if we're wanting to share or, contact you regarding electronic communications with, so you can, opt in yes, or you can also select no. And the final step in the portal account registration, you're going to select register. Next slide. All right, now that we've gone through all of those steps and filled out that important information, your account has been successfully created. And you'll actually receive this little notification on your screen. And then again, you're going to check your email for instructions on how to finish your registration. And that's that link that we talked about earlier, where it's good for 2 hours to confirm your registration. Next slide. All right. So after you've actually, you've received the link to complete your registration, it'll bring you back to the main screen. And then you'll also be prompted to log in. Now, each time you log in, there is a multi-factor authentication tool. So a little quick tip is, if you don't want to have to multi-factor every single time that you log in, is to select that little checkbox underneath your sign in. It says, remember this device for 30 days. Make sure you select that box. So that way, the first time you log in, you will have to multi-factor. But after you select the checkbox, you will not have to do this for another 30 days. So just want to provide that little tip that'll help guide you and make logging into the portal a little easier each time. Next slide. All right, so now we're going to highlight and go over an overview of main navigation and features in the online portal. So this is the actual portal home screen and patient dashboard if you have a new account. So this is your first time, you've created your registration, you don't have any applications yet, you want to, start an application, you're a brand new user. This is what your patient dashboard is going to look like. And as you can see in the little box beside us, as you complete applications and submit claims, information and data will start populating into these created applications, recent activities, and actions required. And also, just want to highlight at the bottom right of the page a little let's chat. If you're having any questions or need any portal assistance when you're on your dashboard or in the portal, at any time you can select that let's chat and we can connect you with a representative during normal business hours to help guide you. Next slide. All right. So this is the portal home screen. If you are you have an existing account and have an award. So you will see your recently completed application will show up on your screen. It'll show your award balance. There's lots of different, things and activities that you can do on this screen. You can view your application details. You can look and see when your effective date is for your application. So for most of you, you might look at that as the look back date. Also is on the screen, and then the expiry date. So when's my application going to expire and when can I renew? And then also, great tool to keep track of your available balance. Recent activities, this will show any activities. So if you're recently approved, it'll show right there on the screen, and any actions required. So if you were selected for income audit, it may show that you need to submit income. If not, you've automatically been approved, then the only thing we're needing is the diagnosis verification form. Next slide. All right, so the applications tab. So on the applications tab, this is where you can actually create a new application. So if your award is expired, this is where you would come to reapply. You would select create application. Also, you can find information about your existing award, as we kind of stated on the slide before. So your effective date, your expiration date, your look back date, and then you can also view all of the application details regarding your grant and award on the screen as well by clicking on that view application details. Next slide. All right, so now just highlighting the chat feature. So as I stated before, the chat feature is in that bottom right-hand corner. If you need any help at any time, please, start by clicking the Let's Chat button in the bottom of the screen. Now, our normal business hours are Monday through Friday, 8:30 to 5 p.m. Eastern Time. So during those times, you would be connected with a representative. Next slide. All right. I've enjoyed my time talking with you guys. I'm now going to turn it over to my colleague, Sarah Krusky, and she's going to review over with you applying for a Total Assist grant.
Hey, good afternoon, everyone. I'm going to walk you through the steps on how to apply for a Total Assist grant on our online portal. So the first thing, there's 6 steps to our application, or 6 parts. Prior to starting your application, I highly suggest that you gather up your information, your insurance information, your authorized person's information, so their phone number, address, and your um, medical provider's information, including their name, phone number, and fax number. As you're entering the application in the system, once you've completed all 6 sections, in most cases, patients are notified that they are instantly approved and you can begin using your Total Assist grant right away. Next slide. In order to start the application, once you're logged into the portal, navigate to the Applications tab and click the Create Application button in the upper right-hand corner. Then you will be prompted to start your application. Your address is already in our system, so that information is pre-populated on this screen. However, we do ask that the address is verified using our Verify Address button. We have a system in place to verify all known postal addresses. And when you click the Verify Address button, it'll give you a message if we were able to verify your address or if we were not. Next slide. Even if we were unable to verify your address, that's okay. We can, we still accept it. We know sometimes there's those one-offs that aren't matching 100%, but they're valid addresses. Just verify that on the screen and click the Keep Verified, Unverified Address buttons if your address is correct and there are no changes needed. And then after you verified your address, it'll scroll down a little to select your diagnosis. You'll select your diagnosis from the drop-down menu, answer some questions about your insurance coverage, and then your insurance type. Do you have Medicare, Medicaid, commercial insurance? And then the fund that you're applying for. Only funds that you are eligible for based on your address, your diagnosis, and insurance status will display in the fund applying for drop-down menu. Once you've filled out all of that information, click Next to proceed to the next part. You'll receive a pop-up screen that asks you one more time to verify your address. We just want to make sure that the address in the system is your correct address. Review it and then click Confirm to continue. This will now move you into our pre-qualification section of our application. This is where we're asking qualifying or questions that determine eligibility into the fund. They are questions like, are you currently in treatment, planning to begin treatment in the next 60 days, or have you been in treatment in the past 6 months? Do you have medical or prescription insurance that covers a portion of your pharmaceutical products or medications being prescribed for your diagnosis? Are you a legal resident of the U.S. residing in the U.S. or U.S. territory? And we also ask an additional question. This isn't an eligibility question, but we do ask that you rate the impact of this grant on a scale of 1 to 10, with 10 being high impact and 1 little to no impact. This is really how helpful is this grant to you? And then on the next screen, after you've hit next, it will pop up. You'll get in the upper right-hand corner a pre-qualification successful message in green, letting you know that you are eligible for this fund based on the information you've provided so far. So you will continue. You'll scroll down to complete the sections. The first will be the address, your address details. Again, this information is already populated for you. And then you'll continue to scroll down to enter the contact information. I know Jennifer talked about when you're registering for the portal, and we offer a preferred method of contact via mail or email, a preferred language of Spanish or English. And those are really great ways to get your communications. If you're selecting email, those application and account documents will generate in your account as soon as we generate them on our end. Mail, they'll be mailed to you as soon as once they're printed and sent off. Then you'll also enter the additional information section. This is again, you're verifying this information here. It's already generally in our system, just verifying that everything is still correct and accurate. And we also ask a question if you receive assistance from other copay programs. This doesn't affect your eligibility in our program. It's just another data collection question that we ask. Then you'll be asked to fill out the applicant information section. If you're the patient completing the application on your own behalf, you would select self. If you're a caregiver, you would select caregiver, and then we would collect additional information about you. And then we also will ask the referral information. How are you referred to the program? And select the option from the drop-down screen and then click Next to continue. Next, the authorized person section will display again. If you already have authorized users on your account, they will display here. You can use this time when you're creating an application to make changes or to add more. And if you need to add more, there is a button that says add one more on the screen. You can add as many additional authorized persons as you need to help you with your grant. Once you've gone through and verified all of the information in the authorized person section, click Next to continue. Next, we'll ask you a few questions about your insurance information. Your insurance type will populate on the screen based on information that you provided us at the pre-screen section. We will ask your insurance plan type and your primary insurance carrier. If your primary insurance carrier is not listed in this section, you can type it any name to proceed. We'll also have a section on the insurance info, which asks if you have secondary insurance. If you have a secondary medical insurance, click yes, and you'll answer a few simple questions about that. If not, just leave it as no and click next to continue. This will bring you to the medical tab. This is where you will select your treating provider. The TotalAssist program does verify diagnosis for every application, so this section is very important to ensure that we have accurate treating provider information so we can send the diagnosis verification form to your treating provider to confirm your diagnosis and eligibility within the program. On this tab, in the blue section, you will enter search criteria to locate your treating provider. I always suggest using the state and city first of where your provider is located, and you can always add a zip code or first or last name, any information to help narrow the list of treating providers to select that will display below based on your search criteria. Once you've located your provider in the list below from your search criteria, click on that provider, and then a pop-up box will display asking you to verify the patient's address. The first thing you will do is select the address type from the drop-down menu. This is because we know many providers work at several different offices, and while the provider record is under the same account, you may see the provider in one office instead of their main office. So all of those addresses are available here for you to select from. And once you click submit, additional contact details will populate for the provider. Please confirm the phone number and the fax number for your treating physician or treating provider are accurate on this screen. We will automatically fax the diagnosis verification form to the treating provider listed in your application. So that fax number is very important to ensure we are faxing that over to the correct office so we can receive that back in our offices. Rest assured, we do the follow-up with the provider's office on your behalf. And once you've finished all of that on that screen and have hit submit, you will continue to the medical tab and back to the treating physician screen. You will see your treating provider highlighted in blue, and after confirming the contact details, scroll down to the page and click next. This will bring you to the medical tab of the application. This is the tab where you'll verify your diagnosis, your treating provider information one more time, enter your data diagnosis, and then enter the medications or treatments that you are currently taking for the diagnosis that you are applying for. Please note with the data diagnosis, if you were recently diagnosed, it is important to get as close as an accurate data diagnosis as you can. But if you were diagnosed several years ago, please, an estimate of fine is fine for your data diagnosis. I don't want anyone worried that because they don't know, 10 years ago what that date was, it's okay. Just a general guesstimate on when your date of diagnosis is great. Once you've filled out these sections, click Next to continue. The final section of the application is our Authorization tab. This is where you'll review our patient agreement, and you'll click the View Patient Agreement. The patient agreement disclosures and attestations will display on the screen. Please review this information, check the check boxes. Once you've read through all of this information, you will acknowledge that you have read and understood the patient agreement disclosures and attestations. If you have any questions at all, if you make sure to give us a call to get those questions answered before selecting no. If you select no, the application will not be submitted. Please make sure you're selecting yes to proceed. Then on the same screen, you'll go back to our Authorization tab, and you'll be back on the opt-in screen. On this screen, you'll be able to opt in or opt out of communications from the Patient Advocate Foundation and the Total Assist program by answering this question. We'll still continue to send you application updates regardless of the answer here, but this is to get additional information about us. We may send out additional information about your diagnosis or things going on within our organization. So we hope that you do opt in to receive other additional communications from us. You can also go back on this screen if you think you missed something or realize you need to update something. You can click the previous button to go back to the previous portions of the application. If you feel like everything's ready to go, click Sign and Submit, and that will submit your application to us. Once you've clicked Sign and Submit, the system will automatically display your application status. In most cases, applications are instantly approved, and you will receive a congratulations message, along with the virtual pharmacy card that you can begin using right away at your pharmacy to help you pay for that out-of-pocket cost for medications. The virtual pharmacy card you can use at retail and specialty pharmacies, and that information will display on this page. You can also view the claims guide, the Total Assist claims guide. This is a really great tool for you to see the different types of services that can be submitted, and then for each one of those claim types, what documents we need in order to be able to process your reimbursement or payment directly to your provider or insurance company. On the Applications tab, you can also view all application information that you entered. You can also upload documents. If your application was flagged for income verification, here's where you would go to upload those documents. You can also view your account correspondence, so your approval packet and any other letters we may send you. You can always navigate back through to the Applications tab to view those program letters. You can submit claims and view your application status and your pharmacy card here at any time. When you're logging in and you will come straight to the patient dashboard, or after you complete your application, if you go back to the patient dashboard, you'll be able to see your recently created application right there on the main screen. You'll be able to see the grant amount, the amount you were awarded, and your application effective date, expiration date, and your look back date. The Total Assist program does offer a look back date for all patients to help assist with those services you may have had or paid for prior to learning about us. You can also view recent activities. Those are the things that you did or any actions required. You will always see the awaiting diagnosis verification until we've received that completed diagnosis verification back from your provider. We do follow up with your providers after 15 days if we have not yet received your form. We want to make sure that you're getting the help that you need. Next, I'm going to walk you through how to submit and how to manage your claims. As a reminder, when you're going to the pharmacy, you take your virtual pharmacy card with you. Print this page out. Your pharmacy can use the information on the card in the purple box to cover that out-of-pocket cost for you for medications that are covered by the program. It can be used to pay things for your copay, your coinsurance, or your deductible. And again, on the same page is that TotalAssist claim guide. TotalAssist claim guide. Make sure you are reviewing this before you're starting to upload claims because it'll help you have the tools you need to ensure a successful claim submission. Now, when you're going to submit a claim, it's 3 simple steps to submit a claim to us for processing. Who the claim is payable to is that you, a provider, or an insurance company. You'll upload the supporting documentation for your claim, and then you will sign and submit the claim to us. To submit a claim from the Applications tab, you can do this one of 2 ways. On the right-hand side of the screen, you will see, on the left-hand side, on the claims, you'll click on Claims on the left-hand side from the navigation menu, and then click Submit a Claim. This will open up the claim submission screen. Here, you will select first who the claim is payable to. If that's you, the patient, select that from the dropdown, or if the patient is a minor, answer patient or patient guardian. The check will be sent to the guardian on file. Then you'll see the address below. Verify that the name and address is correct and click Next. Here, the next screen is where you will upload the supporting documentation for the claim. You can either click in the box to select the files from your computer, or you could drag and drop from your file folder on your computer to upload to the claim. We accept PDFs, JPEGs, or images in this box. Once you've uploaded your documents here, you will see them display below the box, just like this document below. Once you see this, you know that your claim documents have been successfully attached to your claim. Once you've confirmed that those documents have been successfully attached, click Next to proceed. This will bring you to the claim submission attestation section. Here is where you will review the statements on the screen, enter your name, and then click Sign and Submit to submit the claim to us. Once you've done that, you will see on the upper right-hand corner a green flag letting you know that the claim was successfully created. And if for some reason there was an error in the claim submission, you would receive a red message in that upper right-hand corner of the portal. Now, you can always review the details of claims you submitted. You can review their status by going to the application, viewing the application details, and navigating to the claims column. Here, you can view the claims and view their status. You can also view additional information about the claim by clicking the purple eye action icon. This will give you the full claim details. You will be able to see how much we paid, if the claim was processed, if the claim was denied, a claim denial letter letting you know why we were unable to process the claim, or if we are requesting additional information. You'll be able to see any documents that you've attached. All of that information will be located in the full claim details view of your claim. Well, thank you so much for letting me walk you through submitting an application. Next, I'm going to turn it over to my colleague, Brittany Stuber, to walk you through renewing a TotalAssist grant.
Thank you so much, Sarah. As we mentioned at the top of the presentation, I'm Brittany Stuber, Senior Manager of Provider Program Outreach. And now that Sarah has given you a full understanding of how to apply for grants in the Total Assist portal and begin making those claims, I'm going to cover some other workflows and activities that you'll be using the portal to complete. First is we're going to go through renewing a Total Assist grant. Renewing a Total Assist grant in the portal is quick and easy. You can renew a Total Assist grant beginning the day after your current grant expires. So keep in mind that our grants are designed to run 365 days. So on that 366th day, you'll be able to apply as long as funding is available in your particular fund. In the Applications tab, you'll recognize expired grants by their color and their label. So they'll be colored orange at the top, as you see here in the call out box, and they're going to have a label in that upper right corner that reads expired. That's how you can kind of quickly locate those in the portal. All right, so you've seen that you're eligible for renewal by waiting until the day after your current grant expired and what is next. To renew a grant, you're just going to go and follow this exact same process and steps you did when you applied for a new grant. You're going to navigate to the Applications tab, click Create Application, and then follow all of the prompts that we walked through earlier to complete your application. A final tip here, before you begin that renewal application, what I would always suggest is remembering to check TotalAssist.org to see if your fund is open. Now that we've covered renewals, let's talk about accessing your additional funding. So just like renewals, we work to make accessing additional funding fast and easy for you. Here at the Patient Advocate Foundation, we operate under what we call a guaranteed grant model. And what that means is that the initial award or the guaranteed amount is designed to cover 100% of out-of-pocket costs for most patients within that covered disease. However, we know that depending on your insurance coverage or other details, some patients might need additional resources to cover their out-of-pocket costs. So in that case, if you use up your initial guaranteed grant amount before the end of your 12-month eligibility period, you may automatically receive additional funding from what's called our unguaranteed portion. This is always based on the availability of funding, like everything we do at the Patient Advocate Foundation. To access that unguaranteed additional funding for a grant, all you or your provider or pharmacy has to do is submit a claim of any type. If funds are available, we'll automatically award unguaranteed funds to cover any additional expenses up to the maximum award amount for that fund. There's no need for you or your provider or pharmacy team member to make a call to the program or to apply for additional funding in order to access this additional support. Let's put this concept in action by using an example illustrated on the right side of your screen. So the Total Assist Breast Cancer Fund guarantees that all patients will have access to $3,500 for eligible expenses related to their breast cancer diagnosis. If their needs go beyond that amount before their grant expires, so say they've used $3,400 of that amount, but then they get a bill for an in-office infusion treatment for $500, what they're going to do is simply make a medical claim for that full $500. And if funds are available, we'll cover that additional expenditure using what's left from their guaranteed amount and then start awarding from the unguaranteed portion of their grant. We'll continue to offer other additional expenses and cover those up to that maximum award amount you see here of $6,500. And again, to access those unguaranteed funds for additional expenses, remember, you or your provider or pharmacy team member just needs to submit the claim. If you'd like to check out a full list of all of our funds with the full grant assistance amounts, head over to TotalAssist.org. So we covered a lot of content today. Here at the Patient Advocate Foundation, we want to make sure that you are set up for success when you access Total Assist and all of our programs. So in addition to the full recording and today's slides, we're also going to set you up with some helpful guides and additional resources. The first is a short checklist guide that's going to help you prepare for the launch of Total Assist. This guide covers key information and activities that you might want to complete before July 1. We'll share these guides with you after the presentation, but you can also access it directly from this slide deck by clicking on that bold and underlined hyperlink that says Patient and Caregiver Checklist. Next, we've developed a comprehensive Total Assist FAQ document that covers everything from eligibility and enrollment to how legacy grants work, how to submit claims, and more. We know many of you are asking questions right now, and we're working fast and furiously behind the scenes to provide those answers in real time. But keep in mind, we will also share this FAQ document, and you'll receive a link to download it in your follow-up email. It's also going to be available for download beginning on July 1 at TotalAssist.org. Finally, and we're going to go next slide, please. Yeah, we talked about our claim guide. So the Total Assist claim guide, we mentioned it several times in today's presentation. You learned that this lives in the portal 24/7 and can be downloaded right from the same page where you access your pharmacy card. You can navigate to that, if you recall, by going to the Applications tab, selecting your grant, and viewing the full application details. We're also going to provide this resource for you in the follow-up email, and it will be available at TotalAssist.org July 1. So now that you're all set with resources and support, I wanted to take a few minutes to remind you of our launch timeline. The first thing that comes is our pre-launch period, and that's what's happening between today and July 1. So between today and tomorrow, Friday, June 26th, all of your current grants are going to continue without interruption. Patients and providers can continue using all of our existing portals. So those CPR portal and the PAN Foundation portal are going to be available through tomorrow, June 26th at 5:30 p.m. Eastern Time. A reminder that your eligibility and your grant terms are going to remain unchanged in this period. And new and returning patients can continue to apply for assistance through either the Patient Advocate Foundation's Copay Relief Program or PAN's Financial Assistance Program. So I got a question that was in one of our Q&A about if a grant was open, should they go ahead and apply? We would encourage you, if there's a grant open today that you'd like to take advantage of at either Patient Advocate Foundation CPR program or PAN Foundation, do go ahead and make those applications. On Saturday, June 27th through Tuesday, June 30th is our program downtime window. So that's why I want to go ahead and get those applications in today, if at all possible, through tomorrow. Because starting then, after tomorrow, we will be in a short downtime period while we migrate data and get ready for the launch of Total Assist. So during this time, an important notice here that our CPR and our PAN call centers are going to be unavailable, and also our portals will be unavailable. Our grant enrollments and re-enrollments are not going to be available during that period either. So if you need to do work like making a claim or making one of those enrollments, go ahead and take care of that before the downtime period. But just in case you don't get it done, don't worry, we are relaunching just a few short days later on July 1. And that is our big day, the launch on Total Assist. So this slide has a lot of content on it. We'll just take it one by one. So Total Assist will launch on July 1st, and all new grant applications are going to go through the United Total Assist program. On this day, any of you with a legacy PAN copay grant are going to start to have that expanded coverage we talked about in the last webinar. And just in case you missed it, that means in addition to medication copays, starting on July 1, your existing PAN copay assistance grant will now cover health insurance premiums, office visit copays on the day of treatment, and treatment-related administration charges. All other legacy grant coverage for the CPR program and for premium assistance grants at PAN is going to remain the same. On July 1, we'll also be launching the Total Assist United Call Center. So beginning at 8:30 a.m. Eastern Time on July 1, you can call us toll-free at 1-866-512-3861. We've also included the fax for Total Assist here as well in case you need that handy. July 1 is also going to be the launch day of our new provider, pharmacy, patient, and nonprofit portals. So everything you see today for those portals is going to be available starting July 1. Important reminders here. If you have a CPR portal account, you'll just log in using those same credentials. If you have a PAN portal account, you're going to reset your password and use your same email that you've used for the PAN portal as your username. And if you have both portals, you're just going to use your CPR credentials to log into the new TotalAssist portal. So that same email and login. No need to reset your password. Finally, we're launching the TotalAssist website, which you got a sneak peek of at the very beginning of our session. This is going to be where you go for your portal access, your help center, your eligibility checker, and fund opening resources, including signing up for those fund opening notifications. An additional note, all of your grant-related communications starting July 1 are also going to be branded as TotalAssist. So this includes legacy programs. Even for legacy grant recipients, all your communications moving forward starting on July 1 are going to be branded as TotalAssist. And that brings us to the final portion of today's webinar, which is our Q&A. Many of you have been submitting questions throughout today's presentation, and our team continues to work on giving you the real live answers to those questions as we're here. We're going to try to get to as many questions as possible live. Many of you also submitted questions when you registered for today's event. So we've selected several of those questions that were frequently asked to cover today. The first question, if a patient is enrolled in a TotalAssist grant by a provider, a pharmacy, or an advocate, does that patient also have account access? The answer here is yes. A patient enrolled in a TotalAssist grant by someone else does have account access. If they don't already have a portal account, they can register for a new TotalAssist portal account by following the instructions Jennifer shared earlier in the presentation. Otherwise, they're going to follow these instructions, and we've shared this a few times. So if you have a PAF copay relief program and you're a portal user there, you're just going to log in using those same credentials to access TotalAssist. If you have a PAN Foundation portal, you're going to select Forgot Login or Password on the TotalAssist portal login page, enter your PAN portal username, that same email, and then follow the prompts to reset your password. And then if you have both accounts, you're going to follow the instructions for the copay relief program. So just using that same login for the CPR portal to access your account. Our second question, when renewing a grant or applying for other grants, will my existing data be pre-filled for my current grant, or will I need to type in everything again? The answer here is yes. Some of your patient demographic information, like your name and your address, are going to pre-populate when you renew or apply for other grants. You might still need to complete additional demographic information, veteran status, marital status, race, and more upon completion of the first application in the TotalAssist portal. For subsequent ones, we will retain that information, but again, if you're applying for the first time, we might ask you for some additional demographic info. You always need to indicate your diagnosis, your insurance type, and your fund every time you do a grant renewal or apply for a new TotalAssist application. Okay, moving on to our third question. When expanded covered services for legacy PAN grants are offered beginning July 1, will expenses prior to this date be covered? The answer here is yes. Eligible expenses prior to July 1 may be covered as long as they are within the patient's original grant coverage period. So you can check your grant eligibility and look back dates for all awarded grants in the Applications tab of a patient portal account. Remember those additional covered expenses starting July 1 for PAN copay grants include things like health insurance premiums, those day of treatment copay, and your administration fees related to your treatment. So do take advantage of those expanded coverage options. We'll take a next look at our next question. So what if only a health equity or a metastatic fund is open? How does eligibility differ with these funds? This question is just about kind of our different fund types that we offer at the Patient Advocate Foundation. We offer several fund types here, including general funds, health equity funds, and metastatic cancer funds. So let's look at health equity funds first. The health equity funds have the same eligibility criteria as the general funds for that corresponding disease state. And the example here is breast cancer and breast cancer health equity. However, the health equity fund is going to have one additional requirement is that the patient has to reside in an eligible county that's covered by our health equity funds. Not to worry though, there's nothing else for you to do when you apply. All patients are automatically screened for health equity funds when they make an application, and we'll let you know right then if you're eligible for a health equity fund. Patients meeting this additional criteria are eligible for either fund, so either the general fund or the health equity fund. An important note here is that this is an either, not an and. So if both funds are open, that health equity fund and the general fund, and you are eligible for both, you can only enroll in one fund of the same disease name. And let's look at metastatic funds because it's a similar concept. Metastatic funds have the same eligibility criteria as the general funds for the corresponding disease state. So in this example, we're giving breast cancer fund and our metastatic breast cancer fund. And just like with health equity, they have one additional requirement is that the patient's disease stage needs to be stage 4. And that needs to be confirmed by the treating provider. Patients meeting that additional criteria are eligible for either that general breast cancer fund or general cancer fund and the metastatic fund. So you can choose either of those if both of them are open. But again, you can only be enrolled in one disease fund of the same type. Our next question. If I currently have a legacy grant and the grant amount has increased for TotalAssist, will I have access to that increased fund amount? Unfortunately, the answer to this is no. All legacy grant awards are going to remain at their original legacy grant amounts. If you ever have any questions, again, you can just log into the portal and go to your applications to see what your remaining fund balance is and to check on the total fund award. Once that legacy grant period ends, you will be eligible to apply for TotalAssist grant at the TotalAssist grant award amount if that fund is open and accepting applications. And our final question. So in the TotalAssist portal, will I be able to see legacy claims information submitted prior to July 1? For this one, if you have a PAF, Copay Relief Program legacy grant, you will be able to see all claims information prior to July 1. So again, that's for Legacy Copay Relief Program. If you have a PAN Foundation legacy grant, you will only be able to see pharmacy transactions and the total amount of claims paid out to your grant prior to July 1. You will not be able to see specific claims details, including medical claims, premium claims, and patient reimbursements. But not to worry, if you do need access to those details, please contact our team and we can help you. You can email us at totalassist@patientadvocate.org. You can chat us at totalassist.org. And remember, you can access that by clicking the icon in the bottom right corner of your screen to chat us live. Or you can give us a call at our 1-866-512-3861 number, and that's available Monday through Friday, 8:30 a.m. to 5:30 p.m. Eastern Time. And with that, we have come to the end of today's presentation. Thank you again to everyone for joining us today. We hope you found this information informative and helpful as we approach the launch of TotalAssist on July 1. As always, we are grateful to have each and every one of you as a member of our community.